Welcome to the University of South Carolina College of Nursing series on Calming the Chaos Around Us, a team approach to support children and families. I am Diana Inman, Associate Professor at the College of Nursing. It is a pleasure to offer this series along with our colleagues from the College of Education and School of Medicine. Today, Dr. Robin Welsh is joining us from the School of Medicine at USC. Dr. Welsh is an assistant professor and a child and adolescent psychiatrist. Our focus really today is to manage anxiety for you and your child during this particularly difficult time of uncertainty. As parents and caregivers, it's often difficult to determine when the anxiety or worries are becoming a concern for your child. Today, we want to help you have a better understanding of anxiety in children so you will know when to seek help, and you will learn strategies to help your child cope with his or her anxiety. If your child or adolescent is experiencing anxiety, you are not alone. Anxiety disorders are the most frequent behavioral mental health problem seen in primary care and in child psychiatry. You may ask, why is this important to address? Children with anxiety are more likely to have difficulty with friendships, family life, and school. They may have changes in their mood and be irritable or unhappy. And they also may have difficulty concentrating or become easily distracted. So you can see how this can affect all aspects of their life. Treatment for children and adolescents with anxiety are important to consider. Treatment may prevent the development of mental health problems or drug and alcohol misuse in later life. Anxiety is often not recognized by parents as a medical problem, and therefore children may not always receive the care that they need. We know that for adults that have a diagnosis of anxiety, their symptoms often started in childhood or adolescence.
Recognizing anxiety early and getting treatment is so important. We know from a developmental standpoint that there are some common fears that children present with when we see them in our office. For instance, infants are afraid of loud noises, being startled or dropped. Later on, they can fear strangers, or maybe they fear being separated from their parents. As they get older, toddlers have imaginary friends that they're afraid of, or imaginary creatures or monsters. They're afraid of the dark. Typically, these fears diminish after age 6, and then worries about physical well-being, such as injury, kidnapping, those types of things, and then later concerns of natural events like storms, tornadoes develop. After that, from say ages 8 to 13, children are afraid of the dark, spiders, thunderstorms. School-age children often have anxieties centered around school, such as fear of their teacher, or their teacher might be angry or disappointed with them, or they might get in trouble, anxiety of not fitting in with their friends socially. They also can be afraid of real-world calamities, like we've already discussed, bad weather, natural disasters, bad things that happen, floods. Please remember, children often react more emotionally to a news story or documentary than an adult might. These are normal developmental fears and worries and are predictable to the developmental stage of a child and usually do not persist.
This information can help parents help their child overcome their normal developmental fears or anxieties.
Take your child's anxiety very seriously. It's important to them, even if it doesn't seem important, if it seems irrational to you. Don't try to coerce them or force them into being brave. Getting over a fear can sometimes take time. With infants and toddlers, some ways to help them not get anxious is keeping a predictable schedule and routine. Creating a strong parent-child bond can also help reduce anxieties in children. And when children get older, having great communication between parents and children is crucial. Having positive interactions, family building activities, these are all things that can help a child feel safe and secure.
Thank you, Dr. Welsh. These are great pointers and tips. Aside from these normal developmental fears and worries, my work has shown me that children can experience true anxiety. Anxiety may be a part of healthy development, but also lead to difficulties such as frequent physical complaints. It's been my experience in pediatrics that children and adolescents may often present first with physical complaints such as headaches or stomach aches, and some complain that their muscles are tense. I find this often related to that mind-body connection. How we think influences how we feel and affects us physically.
Yes, Dr. Inman, and to follow up on that point, we need to remember that anxiety is a normal reaction. Our bodies are created to react to normal reactions, to react to stress and dangerous situations. It can be beneficial. If we see a poisonous snake, we need to jump back. We need that flight or flight feeling. It alerts us to things that are harmful. But it can become pathological when that anxiety feeling is present most of the time and causes impairment in our day-to-day activities. This can lead to an anxiety disorder. And anxiety disorders, as we've said before, are the most common psychiatric disorders in children. The prevalence of anxiety disorders in children and adolescents ranges from 4 to 20%. Anxiety sets off our body's alarm, like I spoke of a minute ago, the fight or flight feeling to flee from danger. Our sympathetic nervous system kicks in and is like putting a gas pedal in a car. It triggers the response. It provides the body with a burst of energy so that it can respond to the perceived danger. However, if there is no need to run or fight, there's nothing to use up all that energy. And that is why your body feels the way it does when you have excess anxiety. Typically, the parasympathetic nervous system comes in after and acts like a brake. It promotes the rest and digest response that calms the body down after the danger has passed. This is considered the physiological response of anxiety. When feelings of anxiety persist and don't go away and cause impairment, it can become problematic for the child. And if it happens over a period of time, the child may not know what to do with these feelings, and abnormal behaviors begin to pop up. The usual onset of anxiety disorders in children and adolescents is ages 6 to 12 years. This age period is marked by high levels of normal anxiety because children's cognitive development has advanced beyond their emotional development. They are capable of logic and can understand cause and effect, and at this age they can appreciate the passage of time in serious matters such as the permanence of death. This can be an especially difficult time because they lack the experience with dealing with uncertainty and worry, all of which can lead to anxiety and distress. And we know that anxiety disorders can be inherited, meaning that a parent or relative who has an anxiety disorder, their child may have a greater chance of being anxious. And so having an anxious parent and an anxious child can be significant.
This is great information, Dr. Welsh, for parents to know and to be aware of so that they know what to look out for. We also know that from research that there are certain parenting behaviors that can make anxiety worse for children, such as an anxious parent that copes with their anxiety in unhealthy ways, controlling parents, parents modeling fearful behavior, and parental overprotection. This may worsen anxiety for a child. Another important consideration I want to point out is that if parent-children have arguments, these are associated with increased anxiety symptom levels in adolescents. And how a child learns to manage anxiety is very much determined by how their parents manage anxiety and how well parents can tolerate their child's distress. It is important that parents remain calm during times when their child has experienced symptoms of anxiety, even if they do not feel calm. This will help a child get better at managing anxiety. For parents wanting more information about how to remain calm using a variety of techniques, I encourage you to view part 2 of our series where Dr. Ryan Carlson provides helpful strategies for parents to stay calm as they face the many challenges of the pandemic.
I'm happy to hear you have an expert that will address strategies for parents coping with their own anxieties. This is an important component for the families to all understand how they are each impacted. Moving back to the topic of anxiety control for children, I want to share some strategies for anxiety control that have been found to be helpful for children during this uncertain time. Limiting screen time. This means turning the news off, and it means limiting tablets and video games. Have children active and interacting. It doesn't help for them to hear, things on the news that they can't understand. It is helpful to talk about COVID and viruses and what we can do to help ourselves. Teaching about wearing masks, washing our hands, keeping our distance. Reassuring our children to stay positive is very important. Let them know that we will get through this difficult time together. Check in with your child periodically to see how they're doing, to identify feelings, and to be a good listener. Even if they're not talking, ask them how they're doing. It's important to keep a schedule and a routine, being flexible when needed, of course. Give children time to transition when doing a task. When they are playing their favorite video game, give them a 5-minute warning. Don't tell them to stop immediately. These kinds of things help decrease dramatic responses. Exercise is crucial. Getting outside, getting rid of pent-up anxiety and energy, having good nutrition, good sleep habits, a good sleep time ritual and routine, doing the same thing every night so that the child kind of gets used to the routine and learns to settle down is especially important during the stressful time. We often see what is known as bedtime resistance in children delaying going to sleep. Can I have a cup of water? Can I have something to eat? I got to tell you one more thing. Sometimes children have difficulty falling asleep because they're afraid. They wake up in the middle of the night, and then in the morning they're not feeling rested. Have consistent bedtimes and wake-up times. Even with virtual school, waking up the same time you would wake up if you were going to school is important during this time. And consider whenever you do respond to learning something that's negative or bad news or watching the news, children are always watching you, and they look to you for their cues on how to respond to a situation. And so acting anxious and overly emotional can inadvertently increase a child's anxiety. So having a calm approach is helpful. Another key point is to focus on making sure you are in the moment and that you are not distracted by the chaos around you. We can't control the future, but we can focus on the now. Setting daily goals and agendas will help you and your child. Have your child write down their goals every day. What do you want to get done today? We know that individuals who write down their goals are more likely to achieve them.
That's great information as well. The good news is there is treatment, and when started early, the anxiety outcomes improve for children and adolescents. So if your child is feeling anxious, here are some quick and relatively easy methods to try that may help reduce the anxiety that the children are feeling. So the first thing we're going to talk about is deep breathing, and then we'll talk about relaxation techniques. Deep breathing is one quick way to calm the anxiety. For children ages 2 to 5, I have them do what's called the puffer fish, where they breathe in, puff out their cheeks, and then blow out slowly. And do this about 5 times. There's a really cute video on YouTube that you can find on our resource page that demonstrates how to do this. Another one for this age group is to smell the birthday cake. Pretend as if you have a birthday cake in front of you and you smell how good it is. You take a deep breath in, and then out, you blow out the candles. And do that about 5 times. For ages 5 to 8, another one that's fun to do is to pretend like you have some hot chocolate in front of you and you want to blow out to cool it off. So you want to smell how good it is, so you take a good deep breath in and then blow out to cool off the hot chocolate. And this is one of my favorites that I love to teach families and children to do, is give me 5. And just hold up your hand, and as you breathe in, you go up the finger, and then out, you go down the finger. So by the time you get to the 5th finger, you are nice and relaxed. And there's a physiological response that happens. It drops our heart rate and lowers our blood pressure, and helps you to feel calmer. And then there's some teens really like to use apps. So there are some nice deep breathing and relaxation apps that you'll also be able to find on our website. It's important to practice these exercises. So set a daily alarm to practice relaxation and breathing techniques, because you want to practice these before the child is anxious, so then they know what to do. Encourage your child and praise them when they use a technique. For example, say, "I love how you're practicing your deep breathing." Model the behavior you want your children to practice. So you may want to practice these techniques as well. Other strategies that can help if your child is having difficulty going to sleep is what I use as relaxation or deep muscle relaxation, where you have them start from their head down to their toes and they squeeze each part of the body, starting with first the head, going to the shoulders, arms, legs, and then they slowly release all the tension. This can kind of help them to relax and fall asleep easier. And then I like positive imagery for older children. I call this "go to my happy place," or go to a place that you find that you enjoy being. Some adolescents like to go to the park, a picnic, or something that they've recently enjoyed, and go back to that and relax, take deep breathing and calm down. And then staying in touch with families and friends is really critical during this time. So making sure that you have that connection. You will find examples of these exercises as well as other resources on the University of South Carolina College of Nursing website link found at the end of this presentation. We hope you find these techniques and tips helpful. There are many different types of anxiety disorders in children and adolescents. If you are concerned that your child has an anxiety disorder, please seek professional help. Cognitive behavioral therapy, we call CBT, has shown to be helpful for those with mild symptoms, and for moderate to severe anxiety, it's important to obtain professional help for your child. There is treatment such as therapy and medication that has been effective in treating anxiety. Dr. Welsh, I just want to thank you for joining us today. The information that you provided is going to be really helpful to families and children who are experiencing anxiety during this difficult time.
Thank you. It has been my pleasure.
As we conclude this session, please remember that you can revisit this presentation and others in this series by going to the University of South Carolina College of Nursing website, where you will find additional resources to support you during your journey. Thank you for joining us. Take care.